What is going on, everybody? It is Mark Cargill, lead faculty and CEO here at Modern Pain Care, where we make you the complete clinician. This week, we have a little different format for the podcast. As you've probably heard, Jared and I have been doing a kind of coaching, mentoring program. We've been kind of launching our real first cohort of folks that have been going through it and really been enjoying it. I think it's been the way we'd like to teach going forward, because it gives us that kind of one-on-one ability to really dive into somebody's practice, to really give the kind of mentoring and coaching that we wish we had. Some I did get a bit in fellowship, but was not maybe is tailored at times to my specific needs. But hence we created this coaching program. And today we're going to have one of our coaching clinicians come in and kind of talk about his experience and where he was at and how it's been for him. But let's bring everybody in. So first, Jared Hall, how are you doing, sir?
I am doing fantastic, man. I'm looking forward to this weekend. I've got two of my good buddies getting married, one tonight and one tomorrow. So this is just going to be a weekend of weddings and parties with a bunch of my friends. So it starts tonight, and then we're going to do brunch all day tomorrow and hang out at the Arboretum in Dallas, and then go to a wedding tomorrow night. And then I'm going to recover on Sunday.
Just going to say, dude, I hope you just have some built-in recovery. 2 weddings. You've been a wedding machine. Every time I talk to you, you're on some bachelor party or some wedding or some. That's just like been a full-time job for you these days.
Yeah, it's that stage of life, I guess, kind of mid to late 20s and early 30s. That's, I guess, usually when everybody gets married.
Apparently, I guess I do remember where it seemed like every weekend in the summers I was doing the wedding thing. But cool, man. Have fun, pack the Advil. Should be a good time for you. Kyle Yuro, you're obviously one of our coaching clinicians, and we've obviously enjoyed getting to know Kyle. But Kyle, if you don't, we know you, but if you don't mind introducing yourself a little bit to the folks who are listening.
Yeah, so I am I guess, really fresh new grad from the University of Delaware. I graduated the end of December and got a quick first-time job. But when I was entering the clinical world, as most of us new grads are, it was a little overwhelming and daunting. And I've been following Jared and some of the other guys on Instagram throughout my schooling, and I kind of just really liked their style and their platform. And so when I reached out to Jared one day, he told me about a mentorship, and here I am, about 10 weeks in, 11 weeks in, 8 weeks in, something like that.
Yeah.
But, yeah.
So you're in the new grad space that Jared and I, as we've been working with you and other folks in the similar, it's been bringing back kind of memories, maybe PTSD type situations of some of the things you deal with when you're a new grad coming into the profession. It can kind of be a existential crisis, destabilizing experience. But what are some of the big issues you felt like kind of transitioning from what you're taught in school and kind of how you're instructed in school, and then what you see to when some of the patients are staring you in the eyes after when you're going into the treatment room? What have been some of the big kind of problems that you faced kind of making that transition?
Yeah, I think, in school, everything was really kind of drilled into us for all of our special tests and all of our hands-on skills and all of our interventions and all that kind of stuff. And then you get a real person that sits down in front of you, and you start to try to talk to them, and you realize that in your head you're just thinking, okay, what special tests do I know? What do I know here? Like, how am I going to do any of this? Because I've got 3 more patients coming in after this eval, and I'm still treating a patient. And then you miss the entire story of the patient. And then you're just hoping. At least I found myself a little kind of blind firing the first couple of weeks with just, I know this is what I need to do, rather than, hey, what did this person just tell me, and just kind of listen and go from there.
Yeah. The communication piece can be huge, and I always talk with students, and I've lectured students and work with university students regularly, but you guys get taught kind of that normative way of communicating with people, where it's just like, I need to get to a treatment threshold and question through, what do I remember on my PowerPoints and in my treatment-based, classification schemes and test item clusters and stuff. But often you miss the story. Jared, any other thoughts you have for Kyle, or questions you want to throw at him as far as kind of where he's at? You're a little bit more close to the to his stage than I am. I'm obviously I'm gray, although nobody can tell because I'm bald as I'll get out. But what are the kind of things you saw in yourself as you kind of saw Kyle kind of navigating through things?
Yeah, I mean, well, we actually talked about this last night on our coaching call. Was that like I had a professor when I was in school who told me, "Hey, that first year out of school, you actually learn more than your entire time in school." And I never really I didn't really believe him. I was like, "Man, I'm learning so much in school." You're like, "You're full of crap." Maybe for those other people, right? Those other people that aren't paying attention in class, like they'll learn more that first year out of school. But he was absolutely right, and it's not maybe as much the didactic stuff, but you develop clinical pattern recognition, and you develop like comfort with communication and interaction. You develop comfort with developing a plan of care and a treatment approach and that sort of stuff. But the big thing that I think that I didn't have, myself coming out of school is I was just trying to figure out that stuff myself, and I was just like, I guess a Roomba, right? Like I'm trying to figure out my algorithm, and I'm just like driving around the room of treatment, bumping into walls, and like, nope, that's not the way. Oh, nope, that's not the way. Get stuck on the rug, and I'm stuck on the rug for like 3 months, dry needling everybody that comes in, and then like my battery runs out, right, and I can't find my docking station. Like that was my first year of clinical practice, and yes, I just came up with the Roomba analogy on a fly, and I like it, and I'm gonna run with it.
Yeah, pretty much just keep your eyes on Instagram. I'm sure you'll see some Roomba graphics, and you'll probably run with that for a week or two, I can imagine, right?
Nick Hanna, if you're listening, do not steal that and beat me to it, because I know you're good at graphics. No, but like, I guess, I wish that I had somebody to actually already give me the framework of the house. Like, hey man, here's the blueprint. Here's like what it looks like. Here's like, don't go in there. That's where you get stuck. That's that rug that you don't want to get hung on. And, that's where you fall off the back steps. Like, don't go that direction. So, I can't speak for Kyle, but what I know that you and I are hoping is that, especially somebody coming out of school, we can lay out that framework, lay out that blueprint, and kind of say, hey man, maybe don't go down that pathway. Here's where you need to go. And you give a lot more feedback a lot quicker. So you develop that treatment algorithm or that approach of clinical reasoning a lot quicker than maybe you would. So maybe instead of that first year out of school taking a year, maybe you get to the point in, 3 or 4 or 5 months that you would be at a year and a half out.
Yeah, I think. Oh, sorry. I was gonna say, I think that's been the most helpful part of the whole mentorship is, coming right out of internships where you have a CI who has a license, you have to practice under their license, and maybe the things I learned in school were different than what my CI is comfortable with, and so you have this mismatch between who you want to become as a clinician, but you still have to follow what your CI is as a clinician. And so coming out of these internships, I kind of had an idea of what I wanted to do. But in the back of my head, it's like, well, this is not what my professors did. This isn't what my CIs did. This isn't what I've seen other clinicians do. Like, am I wrong to think this way? Am I wrong to try to do something that may be seen as like different? And so kind of the most beneficial thing that I've gotten is just like the peace of mind knowing that, I think every time I ask a question or every time we talk about a case or just like the principles about how to be a clinician, it's always, I feel like you guys have done a good job of seeing who all the people are in the cohort as a clinician and like guiding them down their direction of it rather than saying like, no, like this is what I would do as Jared Hall or Mark or those kind of people. And it's just like, no, like here's the principle, here's the concept, take it with your personality, your clinical style and all that kind of stuff. So I mean these past 8 weeks I've just, like I was telling Jared last night, it's kind of like 2 weeks ago I feel like I've just kind of hit a little bit more of a stride because I'm just more confident in my clinical approach and knowing that at least my concepts are the right way, and it's now just about more repetition, more experience, and more all that kind of stuff. So it's been really helpful in that regard.
Yeah, it's I always felt when I was in your stage like, man, all my repetitions were just chucking mud at the wall, like Jared said. Maybe not the Roomba, but it was just chucking everything at the patient, and then just like fingers crossed, like hopefully at the end of that 30, 45, maybe an hour, if I had with the patient, they're coming out the better end. And then I realized once I learned like the clinical process that obviously we're working with you on and others with is, God, now I can actually learn from the freaking patient in front of me. I don't have to like repeat like the chuck into the mud because I have no idea which part of that mud that actually stuck that actually made a difference. But Now with the process, you can actually make your clinic a classroom, which is beneficial. So instead of just running technique after technique and not knowing which one's doing which, you kind of can see your clinical patterns forming and things like that. Have you found it helpful to be a little bit more efficient in clinic as far as to kind of start getting this process down versus the the Roomba chuck and mud approach? Have you seen that kind of come to fruition in your experience?
Yeah. So currently the place I'm working at, I have about 3 patients an hour. So there's not really a whole lot of room for, erroneous mud chucking. It's a matter of, I got to find these bricks that I can stack a little bit easier, a little bit more hardened than just mud. And so going through more of the test retest, kind of stuff like that, and really kind of having a good idea of what I want to do, like the first 20 minutes, like this one-on-one that I have with my patient before the next one start rolling in, has definitely helped, just from a time efficiency standpoint, but also like an effectiveness standpoint, where I'm not just like, let's try these 5 things as I'm trying to watch another patient. It's like, hey, today's plan, I've got these 3 things. I'm going to hope for the best, see if something changes. If not, I know I've got next time, but I know kind of along the way, like I've already chucked these piles of mud and this one stuck. So, just from that regard, it's been much easier knowing that I have, at least some sort of framework going into each patient, just from the volume that I'm seeing currently.
For sure, man. I mean, I think it's been, I was looking at the calendar. I think it's been about, like, I think you're like 10 weeks in right now. And it's been, for me, super fun to watch like growth, right? Because we see each other every single week on these calls. We shoot a few text messages throughout the week. We do the deep dive calls and stuff like that. So to kind of see your thought process evolve in like super rapidly. I'm jealous of, because I was a little bit slower to get there, so I'm jealous of that. But it's been really, really cool to watch on a week by week basis, to see that growth occur and kind of refinement of thinking. And honestly, I would even say a little bit of like, I don't want to use the word humbleness, but like, clinical I guess clinical humbleness, where you're like, okay, like I'm starting to figure out the gray area a little bit more. I don't like have to be right. I don't necessarily have to know the answer, but I have kind of like a thought process and approach, and a kind of a test, retest, and assessment style now, that you don't seem to get nearly as stressed out at this point as you did even a couple of months ago, when you're looking at patients in clinic and maybe something isn't working right away, or you're not sure what to tell them. But aside from that, one of the things that I've really enjoyed is a lot of the side conversations, a lot of the things that come up that aren't like 100% clinically driven. And, maybe it's life driven, maybe it's work driven, maybe it's, personal growth, maybe it's education. And, I think a lot of people have asked Mark and I, like, what does this program look like? What does it look like to interact, through this mentorship interface, or whatever it is? I was wondering if you could just speak to your experience and kind of give perspective on how you've enjoyed it, and what it looks like from, the person who is engaging in the mentorship from your side of things.
Yeah. So I think just sitting in on both the calls, there's a pretty wide variety of clinicians. The more seasoned clinicians, the more recent new grads, and then the brand new grads. And you can, at least for me, I can kind of see, the more seasoned clinicians, they're a little bit more clinical, case by case kind of questions. They're a little bit more refined in their craft. They've got a little bit more settled, and just from that standpoint, it's more like, hey, I need this help for this case. It's like, how do I learn this kind of stuff? And I feel a lot of my question, there's a couple of cases that I've talked about, but it's a lot more like, hey, what is physical therapy? Answering all the questions that I might not have really gotten in school. How do I kind of snowball my career? How do I, take the first steps to kind of get where I want to be 5, 6, 7, 10 years down the way? So I think, there's a lot of benefit just from what I've watched with every kind of aspect of, where you're at currently in your practice. And for me, I feel like at some point, I'll have more of the knowledge about case by case, and how to treat this specific thing, this particular thing. But I went in wanting to ask more about, how do I form myself as a clinician, more of the concepts and like the guiding principle kind of stuff. And that's where I think it's been the most helpful, because it's just all the things that I thought about in school that my professors didn't answer, or I didn't ask because I didn't think my professors would answer, and that kind of stuff. So it's just been really nice to kind of know that some of my frameworks are, maybe in the right direction. Maybe I was, going off the path a little bit, and, now I'm steered on the right way. But from that regard, I think it's definitely kind of just snowballed me and propelled me. Like you were kind of just saying, like the first 4 weeks of clinic, I was coming home just exhausted. I had no empathy left. I had nothing in me. I was just like, man, I got to Thursday and I was like, I don't know how far it's going to go. I don't have a lick. I don't have a lick of energy left in me. And then yesterday, now that clinic's got just a touch better, just the cognitive overload of everything is a little bit less now that I kind of am a little bit more set in my pathways. I'm coming home because I'm tired, because I enjoyed clinic and I got to put a lot of energy into my patients, which has been a really refreshing transition, because I was like, this is going to be a long career if this is me just coming home every night. Like, man, I couldn't even like talk to my mom sometimes. I was like, I just can't. I got no energy left. So it's been really helpful to just asking the questions that put you on the path you want to be on. Like we were saying, there's no set framework as to how these calls go. Sometimes it's like Jared was saying, just side conversations about life, recommendations here and there. So there's a little bit of everything.
Yeah, it's been interesting. It's been one of the surprise things that I don't think Jared and I foresaw coming in. We were kind of, okay, it's going to be very, strictly clinical and things, and we've kind of let it take to whatever folks felt like they needed. And it's been a lot of like, how the heck do I document and stay on top of this when I got, 3 people coming in during an hour time period, and how do I not burn out, man? I don't see myself rolling down this path and surviving it if I keep going on the road I'm going down. And some folks have techs and support personnel. How do I utilize them? How do I get everybody on the team? How do I work with differing practice styles in my clinic? It's been interesting seeing that. Obviously it's been heavy on the clinical side, but just the kind of environment around your practice and your life and your career pursuits and things have been interesting. It's been interesting to see people's really kind of get a little bit more pointed in the direction of kind of how to kind of grow. I think definitely Jared and I would have loved that. I was just kind of like, and I was a kind of a job jump and never found the perfect scenario in my career, because I thought one existed, and I was going to find it. And but then you realize that you can make most scenarios work well for you if you just kind of have some principles and processes in place. So yeah, it's been cool watching you and others in the program kind of see their kind of career. And I love the fact that you're enjoying clinic. I think that is one of those things that I remember too. Is just like, I'm not gonna be able to do this until I'm 60, 50, maybe not even 40. If I keep, this is just gonna crisp me up and burn me out and spit me out. And I think that's another reason Jared Guy started the program, is because we saw a lot of new grads hitting that situation and really struggling. And I know Jared and I both have been there with it. Kyle, if somebody is kind of on the fence thinking about doing a program such like ours, or something just to get mentorship and get coaching, because I think there's this, the weekend course versus like, this gets obviously a little bit more deeper into things. Where do you think this kind of program kind of separates itself from that weekend course, 2-day course, as far as that's concerned?
Yeah, I guess if you make it analogous to clinic, when you start that discharge process with the patient, you're going down from like 2 times a week to 1 time a week to 1 time every other week, and you get to kind of see that patient for the next couple of months, rather than, hey, we hit our 6th visit, whatever it is, and we're just kind of cutting off, and then who knows what I'm about to kind of enter into, or what the patient's about to do, and all that kind of stuff. I feel like it's been really similar in that regard here, where it's like, you're not just getting a snapshot of who I am as a clinician over the weekend. It could have just been a bad week where I then enter a course and I just don't have any, I just don't really engage in it. It's not a good course for me, that kind of stuff. So yeah, there's been some weeks where, because we've had this 10 weeks at this point together, a couple weeks, you don't have the greatest kind of engagement in that regard, but you come back the next week and you get to have a whole new on-call experience. So, and then it also just kind of helps with, it gives you time to get comfortable with, what can and can't be done here. In that weekend course, at least for me, like, I'm not one to jump in super quick day one to just be like, oh, like, let me let me be the one to ask all my questions and get all my answers and all this kind of stuff. So it's allowed a little bit of time to kind of develop that, that relationship between you guys, where I feel a little bit more comfortable kind of reaching out, texting you guys, not just about, again, not about clinic, but just a lot of different kind of things. And that having that 10, 12 weeks to do so helps a ton with just that comfort level. And, that 1 week in clinic, I might not have seen anything that I haven't seen before. So then if I go to that weekend course, it's like, well, I already saw everything I know. So what am I going to learn from you guys? And then that next week, an absolute tornado comes through and I'm like, here's 7-foot evals I've never seen before. Like, I need a little help now. So like that's where it's nice. And that even if that week happened, you still have 3 or 4 weeks where you can kind of process it and then come back and revisit it and see, hey, what else am I missing? Or similarly with the patients, I've had a couple patients, I'm like, these are straightforward cases. And then I'm 6 weeks in and I'm like, all right, this isn't as straightforward as I originally thought, but I didn't miss out on the opportunity to talk to you guys about it. So that's been the nicest part about having a prolonged mentorship in that regard.
Very cool, man. And again, like I said, it's been cool to watch. And one of the things that was rattling around in my head, you were talking about kind of some of the stuff that comes up on calls. Ben, he's always on calls at the same time with you, and he usually comes in. He's always got he's like, what do you think about this diagnosis? Hey, what does the research say on this diagnosis? Let's talk about thoracic outlet syndrome. Let's talk about PFPS. Hey, let's talk about this, that, and the other. Like he's usually got a list of very concrete things. And it's cool to have that in there, because then you have some people listening and everything. But then what was funny is Ben and I jumped on a deep dive call the other day, and not a clinical thing came up. It was like, hey, what is my 2, 4, and 6 year plan need to be? Like, where am I going? And this struggle between principles of stoicism versus a growth mindset. Like, hey, how do I fall in on that? So that's just something that Mark and I never thought, was actually going to come up in a clinical mentorship, was all of this stuff. But it occurred to me, it's like, well, all of this stuff is relevant for patient care too, right? It's not just what their body presents like and what their special test looks like. It's other things like what's going on in their life, what's their plan, what's their experience, what's their goals, and all that sort of stuff moving forward. So kind of with that being said, I was wondering what value that you've perceived out of those small group calls, the rapid fire calls, if those have been more valuable to you, or if the deep dive calls have been more valuable, or you get different things from each one.
I think obviously you get different things from each one. I really enjoy the deep dive calls, at least, the ones that I've had. You do kind of get that hour where it is really just, you can talk about anything. And I think in my experience too, we haven't had too many, clinical deep dive calls where it's just been like, hey, there's so much going on. You're years ahead of me. How do I catch up to that point? How do I surpass that point? And so the deep dive calls for me, I feel like have been really instrumental in framing a mindset of growth and giving me some sort of idea of how to get there. And then it's been a lot of talking about, I know you've got all the book recommendations for me and, the psychology aspect of things and just the human nature kind of stuff. Which for me, that's what I really enjoy, understanding kind of the human as a whole. So those are really cool. And then the weekly calls, at least for me, they kind of I really like them almost as a checkpoint every week. Because when I'm in clinic now, in the back of my, I love all my previous CIs, I love all my professors and that kind of stuff. But everybody resonates differently with, everybody on on that level. And so for me, knowing that I'm in clinic or I'm about to go to clinic, I'm having a lot of these I'm about to say this to the patient, but I know I can't say it because Jared and Mark, I know I'm going to check in on them, Monday or Thursday. And I can't bring up the fact that I just ignored this. So the weekly check-ins are really nice to kind of have for me, that touchstone of hey, someone's going to be watching you a little bit and they probably know that you need to kind of step up your game sometimes. And that just helps me. So they each offer a little bit different of a clinical kind of guys there. And then Yeah, seeing what other clinicians that are as motivated as you and are on the same path of trying to make themselves a better clinician, seeing what their questions are, seeing that other people are going through things that I'm also going through, has been really helpful, especially from some of the more seasoned clinicians. A couple of years out, there's been many times, at least on Mark's call, I know, where I brought up something and this guy's chimed in, oh yeah, that's happened to me. This person chimed in, oh yeah, no, like that's part of the process, all that kind of stuff. So having more clinicians that are striving to be the best clinician they can, and you kind of have just a little bit more innate level of respect for them, is really helpful to know that we're all kind of going through the same kind of just like nebulous experience of just trying to guide our way through clinic in this world of just trying to get people better. So they both offer a lot of different insight, and they're both really valuable, I think.
Yeah, it's been interesting on the calls just to see people, because oftentimes, and I always remember being told this, but like if you have a question, pipe up, because most of the folks in this group are going to have similar questions or similar experiences that they can share, and it's been fun. I think every time I teach a course, and definitely in this mentorship, we get to see other people's perspectives, because everybody might look at a problem and have different life experiences that bring them into that scenario to interpret and maybe act a little differently than Jared or myself. So I've actually had some nice little times where I was like, I didn't really look at it that way, or never ever thought about it that way, as we've been kind of navigating some of these calls. But yeah, it's been fun watching everybody interact and kind of sharing some of their battle stories, I guess, and some of the same struggles that they've been going with in practice. But I don't know if I think let's wrap it up there, because I want to respect your time, Kyle, and I really appreciate, again, Jared and I want to thank you first off for jumping in. It was kind of the I guess initial launching of this program, and we've been pumped to kind of see you kind of go through and grow the way you've grown, and got obviously a lot of continued growth potential that we know you're going to continue to kind of move forward. And it's fun seeing clinicians who are dedicated to their craft, who want to be good, and who don't put a ceiling on what they can accomplish with things. So it's been fun watching you kind of navigate that process, and to be a part of it's been fun. And we're hoping to see other folks who are in similar, because I think your story definitely resonates with how Jared and I felt when we were in your shoes. Like, oh, dude, this clinic is going to kill me. It's nothing as black and white as what I was taught. And I just can't. The freaking empathy meter just is non-existent. Like you said, by Thursday you're struggling to navigate through the rest of the day, and then Friday's a whole nother animal. But so yeah, just wanted to thank you so much. And before we stop today, if any of you guys are listening to this and think this might be something, if you're hearing yourself and what Kyle and Jared and I've spoke about, and you're interested in possibly getting into the program or something like that, or you just want to have a conversation with Jared or myself and talk about, is this a good fit for me? Do you think it would be something that could help me? Jump on modernpaincare.com/supercharged, and we can set up a call and have a discussion with you, see if the program's a good fit, or at least, even on those calls we've had with numerous folks, we've at least been able to give some career advice and some directions, or maybe pointing people to other resources that are available, or other people that might be able to better be positioned to help them with problems that maybe aren't in the supercharged programs privy to help them with. But if it's something you're interested in, yeah, reach out either through that link or message us on social media, and we're happy to have you guys jump aboard and have a call, and we can see if it's a good fit. But anyway, let's wrap it up for today. Really appreciate, again, your time, Kyle. Jared, of course, good seeing you as always. And until next time, we will see you guys next week.